Hi, my name is Dr. Leonard Weiss. I'm a psychiatrist in Austin, Texas, with my clinic called Psychiatry Austin. I wanted to talk about the treatment of anxiety or anxiety disorders in terms of the medication or pharmacological management. Oftentimes, it is important to use medications for anxiety right off the bat in order to get a handle on it while the patient is waiting for the other treatment modalities to kick in, which include psychotherapy or counseling, meditation, breathing techniques, and other ancillary treatment modalities. Getting back to the medication treatment of anxiety, the first decision is, are we going to treat the anxiety with what is called a benzodiazepine or benzo medication, or are we going to use not a benzo medication? The advantages of the benzo medications, which include drugs like Valium, Librium, Klonopin, and Xanax, is actually that these drugs kick in very quickly. They can be used on an as-needed basis, as well as some longer-acting forms around the clock. And they do provide, in a sense, a very good Band-Aid for the anxiety, while the more deeper holistic treatment modalities are kicking in. The disadvantages to the benzodiazepines is that the benzos can cause physical as well as psychological dependence. So a person with a history, for instance, of drug or alcohol abuse would want to stay away from the benzos. Another big disadvantage of the benzos is that in terms of side effects, they often cause sedation, so that the person finds that when they take enough of the benzo to combat the anxiety, yes, their anxiety is much improved. However, they're just too sedated to get through their day. So the benzodiazepines can be a very helpful immediate treatment modality in the right type of a patient. The other type of medication treatment or pharmacological management of anxiety consists of the non-benzo medications. These would include drugs like Neurontin, generic gabapentin. These would include a drug like Inderal, which is propranolol, and lastly, buspirone or Buspar, which is an old-time anti-anxiety medication that has gone generic, so there's no drug company pushing it. However, these non-benzodiazepine alternatives can be very useful, especially in a patient who's having too many side effects to a benzodiazepine, or when the benzodiazepine is contraindicated because of a history of addiction or alcoholism. The other type of medication that is very useful and not a benzodiazepine for anxiety consists of the antidepressant medications. The term antidepressant would be an anachronism in the sense that many of the antidepressants, especially the ones that hit serotonin in the brain, are very good anti-anxiety medications, although we still call them antidepressants because it's simply too many syllables to say antidepressant, anti-anxiety. There, in these category, we have medications such as Lexapro, such as Celexa, such as Zoloft, Prozac, and finally Paxil. Those are the five kind of oldie but goodie serotonin, antidepressant, anti-anxiety medications. And now the newer ones that have come on the market, including Viibryd, Fedsima, and Brintellix.